So people often ask about soy and phytoestrogens and women's health. Now I see we have some gentlemen in the audience, and I know that you're interested in women's health too, because you don't want to lose that woman too early. There are 4 different classes of phytoestrogens. What phyto means plant, so plant estrogens. And I list them there. They're the isoflavones, stilbenes, coumastan, and lignans. You won't be tested on this, so don't worry too much. But then if you don't really want to know those names, there's a list of foods that are rich in phytoestrogens. And the first 2 are the richest. Soy is number 1, and it has lots of phytoestrogens. All beans have them, and peas as well. Black beans are quite rich in phytoestrogens, but soy have the most. And then there's flax. That's the next highest. Flax has a different phytoestrogen in it, and that's lignan. Not lignin like in wood, but lignan. Flax has 800 times more lignan than the next richest food in lignans. So it's really, really rich in lignans, and because of that, there are some therapeutic uses for flax meal that are really interesting and helpful for you. Many of my patients know that I encourage people to be on flax as it lowers blood pressure as well as having other effects. But other food sources of phytoestrogen include garlic and celery, carrots, potatoes, rice, wheat, red clover. I don't know how that got into the list, but some people, I guess, have red clover tea. So I guess you could eat red clover too. I've tried it and it's not too tasty, but we're talking the blossom itself, not the leaves, but the red clover blossom has phytoestrogens in it. There are also sweet potatoes have some phytoestrogens, and they have plant progesterones in them as well. So they're an interesting food for ladies to eat and think about as they're thinking about their health. And then you have several fruits. They contain the stilbenes, particularly grapes do. And then you've heard of another name for stilbenes. One of them is resveratrol. Have you heard of that? That's rich in grapes, and you hear about it in wine, and everybody touts the red wine as being rich in resveratrol. It's also found in plain grape juice. You don't have to have it fermented. But if you really want to get a lot of resveratrol, and hence the recipe again for tonight, eat peanuts. They're more resveratrol or stilbenes in peanuts than there are in red grapes. So you're going to have a phytoestrogen-rich ice cream. Can you imagine that? And I hope I convince you that phytoestrogens are good so that you can like my ice cream. So if you look at the average daily intake of phytoestrogens in our country, as it says there, the average intake is quite low, up to about 3 milligrams a day, whereas if you go to the East or Southeast Asia, they get 20 to 50 milligrams of phytoestrogen a day. Now that's a huge difference compared to what we do here in this country. Does that make a difference? Well, on a population-wide basis, it makes a huge difference in both breast cancer and in prostate cancer. So now I've got men's attention here with prostate cancer. Prostate cancer is much less common there. It's 30 to 50 times less incidence than here in the United States and Western Europe. So maybe you ought to start eating what they eat over there, which is more phytoestrogens. So when you're thinking about women's health and estrogen, the first thing that comes up is often hot flashes, because most women hit that before they hit problems with their bones. And for years we gave estrogens. I remember a gynecologist that worked here at Parkview years ago saying that when he got to heaven he was going to ask the good Lord why he didn't give women estrogen through all their life. Well, he wouldn't ask that question today if he were still alive, because just a few years after he asked that, we stopped giving women estrogen because we know it increases breast cancer rates. Interestingly, this year after we stopped supplementing women with estrogen, breast cancer rates fell that soon. They fell measurably. So we don't do that as much. You can still take estrogen. It has to be done very carefully. But how about phytoestrogens or plant estrogens? They also reduce symptoms of menopause, the hot flashes, etc. I had a patient come in to see me one day, and her husband was along, and she started having a hot flash, and she said, I feel like tearing my shirt off. I said, well, you know, I've seen everything. Go ahead if you want. She said, when I'm home, if my husband touches the thermostat, I just about throw him out of the house. I thought, well, you need something for those hot flashes, lady. So she's not here tonight. Maybe I should call her up. But she's over those hot flashes, fortunately, as that was a few years ago. And what we found is that if you can get somewhere between 40 and 70 milligrams of soy isoflavones, it will definitely reduce vasomotor symptoms of hot flashes and perimenopausal symptoms. And I think that's really important because it won't, as we'll see, it won't increase your risk of breast cancer if you're careful of the sources of the phytoestrogens. And I've given you some kind of measures to go by. 2.5 cups of soy milk a day will get you there. You'd have to eat about half the ice cream I made to get there, but that wouldn't be a big trouble, maybe. But you could have a cup of soy milk with your breakfast, and then a little ice cream for lunch, and then maybe another drink of soy milk for supper, and you'd get there. Or you could have 3.5 ounces of tofu, or a half cup of, a cup of soybeans, the edamame beans. Dry roasted soybeans have a little bit more, as you can see there. Natto has the most, but natto isn't really suitable to most of our palates here in the West. You can get used to it. Basically, they take soybeans and they ferment them with a bacteria similar to sauerkraut fermentation process. Sauerkraut is with a different bacteria. It's fermented with lactobacillus, and soybeans, they use a different one. I've had it, and it's kind of, it reminds me a little bit in its texture between the beans of okra. A little bit slimy, but it has a sour taste like you'd expect sauerkraut to have. And you know, once you get used to it, it's not too bad. I think I'd rather have some natto than a hot flash. You know, that's something you can try. Tempeh is pretty good. The gentleman that's making tempeh in Maine isn't with us tonight, although he's been at several of the lectures. But if you want to buy his tempeh, you can. It's made right here in Maine and all organic. I will say about soy, it is important for you, if you're going to use soy, to buy organic, because most soy that is not organic is grown with glyphosate. It's a GMO soy grown with glyphosate. And glyphosate, as you know, I've said before, is what Roundup, the active ingredient, is. And glyphosate was first marketed as a boiler cleaner, and it worked pretty well. It complexes minerals, binds them, and helps clean the boiler. But it wasn't real good, so they tried it as an antibiotic later. And it was a pretty good antibiotic because it's a chelator and kept the bacteria from growing. But it also kills bacteria in you when you get glyphosate, and it can really screw up your microbiome. So most people that have problems with wheat or potatoes actually have problem with glyphosate, not with wheat. Many of the people that I see with wheat intolerances think they have celiac disease, but they really don't. They have an intolerance to glyphosate. Same is true with soy. Many people think, oh, I can't have soy because it's this, or it's usually you just need organic soy. At the end of the handout, I have a comment about soy and thyroid disease. That's the other thing that comes up. People with hypothyroidism are rightly concerned about what soy will do to their thyroid. There have been two large reviews published in the medical literature, one in 2006, and the most recent one, I believe, was in 2019. And the first one found absolutely no effect from soy on the thyroid, despite what we've heard. The second one, the most recent one, said there is an effect of soy on the thyroid. If you're an infant, it does reduce thyroid peroxidase enzyme, and so it's probably not best to have infants on soy formula. A small percentage of them develop thyroid insufficiency to a minor degree. In adults, soy does increase the thyroid stimulating hormone slightly, but as much as they could tell, there's no measurable clinical effect in people taking thyroid or in people who have normal thyroid. So the hype about soy and thyroid is overblown according to the best research. If you do have hypothyroidism and you're having hot flashes, or you want to reduce your risk of breast cancer or uterine cancer or improve your bones, as we'll see it does all of those, you can still take soy. It's just you need to be in contact with your physician and have your thyroid function measured and the dose adjusted if need be. However, in the study, they found no necessary dose adjustments. And it was a meta-analysis of multiple studies with about 80,000 people in it. So a fairly rigorous study found that all the hype about soy and thyroid is really very overblown. Still, if you have problems with your thyroid, make sure if you go from no soy to soy daily that you let your physician know and have them check your thyroid function. That's important, though probably not a big issue for the vast majority of people. So the next thing that we know about is that breast cancer is much lower in Asian populations as long as they stay in Asia and keep eating that way. Once they move here, their breast cancer risk goes right up to what ours is because their diets change. But the best studies I've looked at show that for every 5 grams daily of soy protein, you get about a 12% risk reduction in breast cancer. Well, that's pretty good. In fact, start taking soy if you're worried about breast cancer. Now, some studies show that if you eat a lot of soy, the breast cancer risk goes up. Now, wait a minute. I just told you that 12% risk reduction with every 5 grams. How can it lower it and raise it at the same time? Well, it depends on how much you're taking and on what type of soy you're eating. So there are 2 types of estrogen receptors. That's first very important to understand. There's the alpha receptors and the beta receptors, and soy stimulates both. The alpha receptors, when they're stimulated, they cause breast tissue growth and tumor cell growth. The beta cells do the beta receptors do just the opposite. They turn off cancer growth and they reduce breast tenderness. Breast tenderness around your menstrual period, for those of you who are still having that, which isn't a lot of us here, certainly not me, that can be a problem, and we'll talk shortly about things that you can do to reduce that. But if you can stimulate beta receptors primarily and alpha receptors just a little bit, then you'll do fine. And that's what we find with usual doses of soy from whole soy foods. Now, if you get a soy protein isolate or a soy isoflavone that's separate from the bean and the other components and get it very concentrated and take a really high dose, you will get some alpha cell receptor stimulation. And in studies where they did that, they took soy and they refined it, and they wanted really strong isoflavone, and well, breast cancer rates don't always go down in some people, they go up. But when you're eating the whole food or the first generation reductions, if we could call it that, or the foods like tofu and soy milk and tempeh, those are refined to some extent, but not highly refined. Those have all shown reduction in breast cancer risk because they stimulate primarily the beta receptors. And that's what we're looking for, is beta receptor stimulation. When you stimulate the beta receptors, you're going to reduce your risk of breast cancer and uterine cancer. And gentlemen, you'll also reduce your risk of prostate cancer if you stick with the whole soy or a simple refinement like tempeh or tofu type of thing. So the other thing that we should look at is bone density. And there's an interesting study, it's a 2-year study, where they had 3 groups of people. They had people that they didn't do anything for, that's the control group. And then they had people that they had them take a progesterone in a transdermal preparation, and progesterone does help bones to some extent. It's not estrogen, of course, but it's a similar hormone. And then they had another group that drank 2 glasses of soy milk a day. The ones that they did nothing for, their bone density worsened over the 2-year period. The ones that had the transdermal progesterone, their bone density worsened, but not as much. And the ones that drank 2 glasses of soy milk a day, their bone density actually improved. And that's good news. I can't put 2 glasses of soy milk into a pill for you, so I can't make a lot of money on it, but I like your bone density to improve. And, you know, drink that soy milk and eat a little of my ice cream and you'll be okay. You know, that's good to know that bone density can actually improve with soy. The reason for that is bone has estrogen receptors in it, but they are predominantly the beta receptor, not the alpha receptor. Now, if you take estradiol stimulates both as well, and it will strengthen the bones, but it primarily stimulates alpha and secondary beta, so you have the negative effect on the breast and the uterus and the positive effect on the bone. But you can get the positive effect on the bone without the negative effect on the breast and uterus by taking soy milk. So there you go. Or eating edamame beans, which is probably better for you even than soy milk. How many people like edamame beans? Yeah, they're not bad. You're going to get a lot more of the antioxidants in those beans, and they're better for your health overall than just the soy milk. But, you know, maybe you like soy milk better than those beans, so you can have that as well. Prostate cancer has both beta-1 and beta-2 receptors, and stimulation of the beta-1 inhibits cancer, whereas beta-2 increases cancer growth. And so, like breast cancer, there are variable results with prostate cancer and phytoestrogen supplementation. But again, if you stick to a soy food rather than a soy refined to an, you know, protein isolate, highly refined, you're going to see a reduction in prostate cancer, not an increase. Now, people have wondered, well, why is this? Well, one of the reasons is high doses of protein from whatever source, whether it's plant or animal, stimulate insulin-like growth factor. And insulin-like growth factor, particularly IGF-1, that's insulin growth factor 1, stimulates cancer growth. So if you get really high doses of a refined plant protein or an animal protein, you will stimulate cancer growth. You're not going to get that much protein if you're eating a whole food. You're going to tend more that way if you have a refined protein powder and you're taking real high doses of it. Then you're going to stimulate or turn on IGF-1 and your rates of cancer are going to go up. That's true of excess calories in general. It's certainly true of excess sugar, and it's true of excess protein as well. So anytime you're getting a highly concentrated protein and pushing your protein intake up to over 100 grams of protein a day, which is hard to do with plant proteins, you're going to see increased cancer risk. And that's some of the risk of high protein diets that people use for weight loss or for building muscle, as you see an increased risk of cancer. But that isn't from the phytoestrogen primarily, it's from the excess refined protein. So recently, the Society of Obstetricians and Gynecologists in Canada made the following recommendation. We're switching a little. We're still on phytoestrogens, but we've switched to flax here. And they said dietary flaxseed should be considered as a first-line therapy for menstrual breast pain. Why? Because it works.
I can speak from experience.
Yeah, it works really nicely for that. But how does it work? It works because flax seeds are rich in lignans, which are phytoestrogens that stimulate the beta estrogen receptors in the breast and block the alpha receptors reflecting that cause breast tenderness. So that's a pretty high recommendation for a society to come out and say, if you've got breast tenderness during your menstrual cycle, take some flaxseed.
It's the same if you're menopausal, I found out too.
Yeah, it does. Menopausal, I mean, if you reduce the alpha receptor stimulation, you're going to reduce breast cancer risk too. Well, now let's look for a minute at flaxseed. What are the side effects of it? Well, if you start off on a high dose, could you get me a drink of water, Lynn? If you start out on a high dose of flaxseed, you're going to get some GI distress because you have to ramp up your microbiome to handle that stuff. It's very high fiber, and you can get diarrhea. Some people get that, others get constipation. Your stool bulk will increase. Here, you can use this. Oh, you got something? Your stool bulk will increase. I had one patient that thought she would really go for flax, and she did, and she tolerated it fine, but she plugged up her toilet. and had to call her neighbor in for help. And her neighbor must not have had a snake. He ended up taking the whole toilet off the floor and up and down, and she made a real mess. So start off slow and drink plenty of water so that you don't plug up your toilet. But that's one side effects of flax. Apart from that, you'll lower your cholesterol because it's high in fiber. You will find that it's good for arthritis. And what most of my patients tell me is that 2 tablespoons of flax a day work about as well as an ibuprofen. But with flax, you're going to lower your blood pressure, you're going to lower your cholesterol, you're going to lower your risk of heart attack, whereas with ibuprofen, you're going to increase your risk for congestive heart failure, increase your risk for myocardial infarction, and increase your risk for stroke because your blood pressure will go up, not down, and you'll increase your risk for a gastric ulcer as well. So I'd rather take the side effects of flax.
Are you aiming for any more than the 2 tablespoons?
No, you don't want to go overboard. The reason for that, I've had a few patients think, well, if a little's good, a lot's better, and consuming up to a half cup of flax a day. There is some cyanide in flax, and if you get a cup full a day of flax, you get enough cyanide that you can start having side effects. It won't kill you. Probably a quart a day would, but maybe for other reasons. So 2 tablespoons is plenty, and taking more isn't really beneficial unless you just really like to increase your stool bulk. It's interesting, one of the original researchers on stools was a gentleman who worked in Africa. Burkitt was his name, Dr. Burkitt. And he had a group of research assistants that went around, I'm really glad I wasn't one of them, and measured stool weights. And what he found is there was a direct correlation between the weight of the stool and health. And he famously said, if you have a country with small stools, you'll have to have large hospitals. And flax will help you have small hospitals, I guess. So there are a lot of benefits to flax besides reducing breast tenderness around your period and reducing risk of breast cancer, and that's helpful to know.
Should we use the whole flaxseed or have ground?
Great question. If you use the whole flaxseed, you need to chew it, because if you don't chew it, it's going to go right through you. Or you can grind it in a coffee grinder. That's what we do. The best is to grind it fresh, or if you buy ground flaxseed, to keep it in the refrigerator, because it will go bad. It will go rancid on you, and you don't want rancid flaxseed. It takes a long time for flaxseed to go rancid, even in a covered container. We keep ours vacuum packed at home. We buy it in 30-pound bags and keep it vacuum packed. And then once we open it, we just put it in the refrigerator and grind it when we need it. So, question?
Yeah, is there a significant difference between the brown type and the golden?
Great question. The difference is color. The nutrition is not different. And take whichever kind you like the flavor of better. The phytoestrogens or the lignans are the same in both. I like the golden taste better, but either one is fine. Yeah. So whatever you like there is absolutely fine. Then I think I might have mentioned this. A meta-analysis of 5 studies showed that soy food intake was associated with better survival in 3 types of cancer, both the ER negative, the ER, that's estrogen receptor positive, and in postmenopausal patients. So regardless of what type of breast cancer, survival improved with soy. Here's just something else for fun. Fennel seeds work as effectively as drugs like ibuprofen for painful periods. However, fennel seeds increase bleeding, and so if you tend to be a heavy bleeder or know someone that is that you're counseling, they might not want to use fennel seeds, although they work very well to reduce menstrual cramps. 1/8 of a teaspoon of ginger powder 3 times a day cuts menstrual bleeding by about half, which is amazing. And it also reduces menstrual cramps as well. So I guess if you took a little fennel and a little ginger and mix it together, you'd have the perfect potion, although I haven't tried it myself. It'd be worth a try. So flax seeds reduce the risk of breast cancer and prostate cancer, as I've mentioned. And one other thing, gentlemen, for you, since you came, we got to have some fun. If you have problems with benign prostatic hypertrophy, one thing that's been shown to work as good as medication, like tamsulosin and prazosin and some of those drugs for urinary retention from an enlarged prostate, is pumpkin seeds. A tablespoon of pumpkin seeds a day works about as well as tamsulosin. And you won't get the problems that you do with tamsulosin, like lightheadedness and dizziness, because tamsulosin or prazosin, more specifically, and terazosin were first marketed as blood pressure medicines. They didn't work too well at that, so we started using them as treatment for benign prostatic hypertrophy. They work because they're an alpha blocker, but as some of you may have noticed if you've taken them, they enable you to empty the bladder better, but you can't hold on to your urine as well. So now you can empty your bladder, but you can't hold on to it. Whereas the pumpkin seeds don't cause that. They work by a different mechanism, and you won't have as many side effects, and they taste better than the medicine. Any questions?
Regarding the tempeh, is there any gain or loss going from the regular tempeh to the 3-grain tempeh?
Well, the 3-grain tempeh is fine, but it doesn't have as much soy in it, and we're looking for the phytoestrogen. So it's fine to take that, but you'll have a little lower dose of the isoflavones.
So using that, we can drink some soy milk?
Yeah, drink some soy milk with it or have some ice cream, and I hope you'll start getting that out. You have some in the freezer, right?
We're waiting for you to be finished.
Well, I'm just about done. Yeah. Okay, so here's my recommendation. Eat 1 to 2 servings of soy daily. Avoid refined soy isoflavones or, the pills and potions, and just go for the food. You're a lot safer that way. Whole beans, minimally refined products like soy milk, tofu, tempeh, or natto. If you want to experience that slimy stuff, it's really high and what you need. And remember that it lowers your risk of breast and prostate cancer, improves bone density, and lowers your cholesterol. Eat flax daily. Flax lowers blood pressure, reduces risk of breast and prostate cancer, lowers cholesterol, reduces pain from arthritis, and as I mentioned, start low and go slow, and then you can tolerate it a little better. Any questions?
I do.
Go ahead.
Are the raw pumpkin seeds better than the toasted, I assume?
Yeah, go for the raw pumpkin seeds, and I guess it starts with a P for a reason, right?
I was going to ask, because I know somebody that does this, and I don't understand the purpose of it, but they grind their pumpkin seeds.
Okay, grind pumpkin seeds, that works really well, and if you don't have teeth, or you can just chew them. It's interesting, when you chew nuts or seeds, you don't do as well as if you grind them. Is that a good thing or a bad thing? Well, both, because if you grind them, you're going to get a little more absorption If you don't grind the nuts and seeds, guess who's happy? Your gut microbiome. So I want my microbiome to be really happy. Why is that? Well, lots of reasons, but one of them is most of us aren't aware of it, but your gut microbiome is one of the major influences of your appetite. If they don't get enough fiber, they signal the brain for you to eat more. And there's some fascinating studies. If you take stool from someone who's thin and on a high fiber diet and give it as an enema to someone who's heavy, the heavy person will lose weight with the skinny person's stool. She says, okay, then just eat high fiber and gradually you'll get over to a good microbiome. And so don't chew the seeds too thoroughly and you'll make your gut bacteria happy. And or you can grind them really thoroughly some days and chew them other days, and that'll be good too. So.
What about the soybean granules that you say that you can cook with?
That's fine, but again, any time that you can have the whole food, the closer you get to that, the less risk you're going to have for the negative effects of soy. And you know, it's really easy with a concentrated food to get too much. It's really hard to eat too much tofu. I guess you could do it, but it would be a slog. And it's way hard to eat too much edamame beans. Try it. Yeah.
Well, and you have to be careful with that as well, because as he was talking earlier about the concentrated soy protein, most of those curls are that.
Yeah.
And that's what you don't want.
Yeah, the soy curls. Yeah. You're far better off just to eat something that's minimally refined. You won't get into trouble with it. Question?
I just had a question about like miso paste.
Yeah, miso paste is great, except it's very high in sodium, so don't use it as a major source of phytoestrogen. But it adds some really good flavor to cooking, and it's a great source. Just don't overdo it. Same with soy sauce. There are some phytoestrogens in soy sauce, but again, it's so high in salt. Be careful, don't have it as a major source of phytoestrogens. I don't want anybody to go home and drink soy sauce. Question?
I'd just like to share, listening to the soy, I've been doing a dessert, which I think must be very healthy, because it's one container of silken tofu, 1 bar of 70% dark chocolate, and 1 tablespoon of maple syrup.
I'll be right over.
And you put that in your blender, because I use my Vitamix, but you put it in your blender, you just pour it in little custard dishes and put it in the refrigerator. It's fabulous. And it must be healthy, because
It's pretty healthy. The dark chocolate, it depends on how much fat's in it and what kind and that sort of thing, and you can look at that. But I'd be happy to trial it. I mean, yeah, you can take avocado and chocolate and make a really, really good dish too. So anybody tried that?
Yes, I do that all the time.
Yeah. But this is, when you're using carob, you don't need to use the sweetener nearly as much.